Tubal reversal is for women that have changed their mind about childbearing. They've had a tubal ligation in the past, and for some reason now want to have more children, either because they've remarried and the husband doesn't have children, or the two of them want to have children together, or sometimes we've done this for women that have had a child and something has happened to one of their kids and now want to have another baby. But for whatever reason, they just want to have more kids. Tubal reversal is the most economical way to get pregnant after a tubal ligation. Okay? IVF is about 2 or 3 times the cost of tubal reversal. So the first option is always tubal reversal, unless for some reason the physician that did the tubal ligation took off a big portion of the tube or the entire end of the tube. In that situation, you can't put the tube together, and therefore it would be better to do in vitro fertilization. Now we do liposuction and thin that area down to where we can do it. So the majority of heavier patients that can be done in an outpatient, that means a BMI 35 to 40 is the limit to be done in an outpatient setting. Those patients can now be done by tubal anastomosis or tubal reversal because we do liposuction of that area first. Success rate depends on several factors. One is the age of the patient. The younger the patient, the better the success rate. Success rate for a woman in her 30s can be as high as 80-85%. 95%, one of the tubes will be open after we do their tubal anastomosis here. So the remaining 15% between the 80 and 95 is basically because of scarring, tubes too short, something else fertility-wise. The second factor for success rates is that length of the tube remaining. If we have more than 5 centimeters of tube, then that's great. Where the tube was actually cut or burned, or where the tubal ligation was actually done, really also matters, because if it's done either too close to the uterus or too close to the end of the tube, the success rate is not as good. The third factor is how the patient scars. That's inherent in patients and you can't change it. A couple of other factors are things that happen to women in their mid to late 30s, and that's fibroids, polyps, and so forth. A lot of times we can take care of those problems at the same time we're doing the tubal reversal. But we need to be aware that things like that are going on, and therefore we do an ultrasound before the surgery or preoperatively to be kind of prepared during the surgery to take care of things. One of the most important things is the sperm count. We really encourage people to have the husband checked with a semen analysis, but we don't require it. Usually women are able to get back to work in 2 weeks. They're up and around the next day. We send them home 2 or 3 hours after the surgery, but you know, it's sore in that area. Can get pregnant almost immediately after the surgery. We tell people to wait a week or 2 at least, but we've had patients get pregnant in the same cycle that they've had their tubal reversal done. NCCRM is unique in that we offer incredible pricing due to the fact that we own our own operating room and that we can do general anesthesia in our own operating room.